And let us show you a video of a doctor, what he's telling us about expectations from the pharmaceutical industry. Satish, can we have the video? Today we have with us Dr. Amit Gupta, Senior Consultant, Cardiology at Shelby Hospital, Jaipur. Welcome, Dr. Amit.
Thank you, sir.
So let me ask you questions. I won't take much time, but there will be questions which I would love you to explain upon somewhere. Ideally, there should be a symbiotic relationship between doctors and pharma personnel. Do you think such a relationship exists today?
For me, at least, I think this relationship exists because I think every system needs many persons, and in India, I think there is a lack of system in medical field, because here we just consult a patient and patient goes back. There is no further, communication with the patients. And even we have many things to do, like we need to upgrade ourselves. We need to upgrade our knowledge. We need to upgrade communications with the patients. And sometimes there are many personal things for which we do not have time. So for me, at least, I have already said this relationship exists because I always need a few persons in my system to fulfill my personal and my professional needs. So for me, this relationship definitely exists.
Okay, Dr. Amit. So I can sense that this relationship is a good one for you. But generally, we see in pharma that the pharma sales personnel are not heartily welcomed by the doctors. So what in general, what can pharma companies do to make these reps calls or personnel calls more welcomed by doctors?
Actually, there are two things I think which is behind this. With what you are telling about. One thing, it depends on the personal nature to whom you are meeting, how he welcomes you. Sometimes you do not want to welcome somebody, or you do not want to hear, but if it is your nature, you hear that person peacefully and give him a warm welcome. And the other thing which is always, exists apart from this, because everybody do not have that nature to understand the other person. The second thing is, it should be useful for a doctor. He should not feel that his time is wasted in formal, just a call in which medical rep comes and just for his training purpose, he tells his brand names. Multiple brands at a time. How many doctors can recall? Because this is not possible to recall every brand, and it is not useful for anybody. So training purposes call should not be there for medical reps, at least who are under training. And second thing, it is always related to relationship building, as we maintain relationship with a few influential persons in the society, and we also maintain relationship with patients also. So relationship building between pharma companies and doctors should be very important. That's it.
Perfect. It makes complete sense. So the pharma is listening here, and these things should be noted down. Another question to you: will you recommend your patients to a patient advocacy group where the pharma company is talking about patient care only, helping you in patient care, telling them about dosage or side effects or something like that? Pharma company will not be talking about the brands or the company there, but would you recommend your patients there?
Like I already said, there should be a system in which many persons should play their own role. Sometimes we do not have that much time to fulfill patients' every need. Like in current era, many patients want to ask directly to the doctor that whether we can go for COVID vaccination or not, and which vaccine should be availed. So, and we also want to answer, but because of time constraint or because of many personal things, we are not able to talk to every patient. And there can be a particular authorized society or authorized channel through which patient can avail or proper information regarding many day-to-day problems of their life related to their own disease. Like many patients want to ask, I am not able to get this brand of the particular drug. So, and they want to ask directly from the doctor, can we avail the other brand? So this is a common problem, and I think they feel satisfied when the doctor says that you can avail the other brand also. But it is not possible for us to fulfill this need, because this is very difficult to talk with every patient related to their every query. I am just giving an example. There are multiple things for which patients become very troublesome, for which many persons can help. So pharma companies can fulfill their needs by running patient advocacy programs, particularly after discussing with doctors and patients what they need in day-to-day life.
Perfect. This was really insightful. And will you suggest any other thing to pharma companies which will help you in your quest towards patient centricity? Every doctor wants to be patient centric. He wants to help patient to even the minutest details. But do you suggest anything else which pharma companies can pitch in?
Definitely, patients are the key point by which this industry is running, whether it is a pharma company or whether it is hospital industry. Everything is related to patients only, so their need should be fulfilled. And I have already said that after discussing with doctors and patients, and even pharma companies, senior persons can sit together to decide whether small things can help to the patients. And sometimes we run a campaign just for blood sugar and lipid profile checkup. It is not, needed in current scenario for many patients. They do not want to get free tests, but they want to get free assistance, continuous helpline, 24 hours sometimes, or at least for 12 hours, where they can call and they can ask their day-to-day queries. So many things are there, but we need to sit together at a particular time, and then we can resolve many problems of the patients.
Wow, this was a perfect answer, because here doctor is welcoming the seniors of the industry to discuss and launch programs for the patients, a truly patient-centric approach. And thank you for taking out the time from your busy schedule and giving this interview. Wish you best of luck.
Thank you for taking me this experience. Thank you.
Thank you.
Bye.
Thank you, Satish. Basically, you saw that many companies may be doing, creating few programs, even implementing them in coordination with doctors. But here, doctors speaking and inviting companies to join them in this patient centricity approach.